Thank you so much for joining us for another media briefing. We have once again assembled a panel of our clinical experts to join you today. We have a few different guests that from our usual guests that we have. We, of course, have Dr. Ajay Kumar, our Chief Clinical Officer here at Hartford HealthCare. We also have Eric Arlia, Vice President, System Pharmacy for Hartford HealthCare, Dr. Ulysses Wu, Chief Epidemiologist at Hartford HealthCare, Keith Grant, APRN, Senior System Director of Infection Prevention at Hartford HealthCare. And we also have Dr. Jennifer Ferran, Clinical Health Psychologist and Director of Wellbeing at Hartford HealthCare. We have a lot of topics to get to today. We'll have each of our panelists give you kind of an overview of what's happening by the latest numbers across Hartford HealthCare, employee well-being, as well as vaccines, and then we will open it up to questions. And if you can just write your questions in the chat, we'll get to them in the order that they're received. So without further ado, let's kick it off with Dr. Kumar.
Thank you, Tina, and thank you all of my colleagues to be here today. Good morning, everybody. So as a system status, I'd like to start with some of the numbers regarding where we are in terms of our capacity, in terms of our volume, in terms of number of patients we have across systems. So let me begin with saying that, these are the times I really feel very privileged and part of and proud to be part of this team like what we have in Hartford HealthCare. Our teams across the system are doing an amazing job to make sure they're ready for access and ready for care for our community members at this time. We have unfortunately exceeded the highest peak we had back in 22nd of April 2020 in Hartford HealthCare. Right now we have 466 patients across the system. This is a large number of COVID patients we have in the system, but really what's important to know that 58 of them are in ICU, and fair amount of individuals are coming into the hospital who happen to be incidental to have COVID, and they have other illnesses they're coming in with. And we can expect that, given the high prevalence in the community, that multiple people have positive tests, but they have falls and other things, and they're seeking care as well. So when I present this number of 466, I want us to see that with a bit of a caveat here. Now, nevertheless, I don't want to minimize the impact that COVID has on our community, and a lot of people are requiring critical care and high-level care in ICUs and our floors related to COVID as well. So we have 44 patients that are in Bacchus Hospital. Charlotte Hungerford has 37 patients. Hartford Hospital has 172 patients just in relation in the height of pandemic. Hartford Hospital had more than 200 patients of pandemic COVID back in first surge. Midstate Medical Center has 46 patients. Nacharg has 7 patients. St. Vincent Medical Center has 75 patients. Hospital Center Connecticut has 70 patients. And Wyndham Hospital has 15 patients. There's a lot of exciting things also happening. Release of new guidance regarding the vaccine, which I know Eric Arlia will cover for the children's, the boosters. We like to focus a fair amount of discussion today on the wellness effort, or the effort we are driving to for colleagues across the system as well. And as always, Dr. Wu and Keith Grant are here to answer any question you have regarding COVID. So with that, I'll pass it back to Tina. Tina, you're on mute.
So sorry. Next up, we're going to go to Keith Grant, our Senior System Director of Infection Prevention. Keith, you want to give us the latest data that you have, some interesting data that you shared with us?
Absolutely, and we spoke about a lot of this data early on this week, and it's regarding, we continue to see efficacy with the vaccine itself. We've continued to see even more efficacy with individuals having boosters, and we're currently analyzing the most current data that we do have. The data that we were talking about is data that we analyzed from Monday, so 7 days onward, or before Monday. And within that data, what we're seeing is of all the patients that we have in-house, and we talked a little bit about this earlier this week, we have 7 individuals that are boosted. So if at that point, the 420 patients that were here, there's only 7 patients that have active boosted. Interestingly enough, additionally, from the patients that are here that are vaccinated, so at that point, the data was 158, from that set of patients, I think 22 of those patients fall into the category of patients who are not qualified for a booster, which means they're at the point where the vaccine is considered most effective. So true breakthrough case, if you look at that subset of data, really is constitutes about 29 patients. Additionally, from the 7 patients that are boosted, there is only 2 of those patients that actually fall into that category where the boosters are most effective. So 2 weeks after getting the boosters. So in fact, in truth, if we look at what breakthrough case, the true definition of what a breakthrough case is, we have 24 patients of the 413 patients at that point in time that are here and are vaccinated. And the breakdown gets more interesting when we look at critical care. We have a very small percentage, I think 3% of our patients that are COVID positive in critical care that are vaccinated as well. So.
Thank you, Keith. Earlier this morning, we held an event. Some of you were there at our event this morning at 7:30, where we had vaccinated 8 children, given them boosters between the ages of 12 and 15. Dr. Wu, you were there. Do you want to talk a little bit about that?
Yeah, it was a very nice event. It was great to see some of the kids that were there, and I said it at the event that I don't consider them brave because there's nothing to fear about this shot. What I was amazed by was their intelligence and their maturity as well, because some of them stepped up to the microphone and said, "This is why we're doing it." And it was never really for about themselves, but most of their reasons were for about other people. And so if they can understand that, we should probably look at that in terms of how we view vaccinations. It's not just personal choice, but it is for not just ourselves, but for other people. With regards to our epidemiology, I'm sure a lot of you are still worrying about, what if this is Delta or Omicron. I think it still represents a mix, with most of it going over to Omicron at this point. You can see that our percent positivity still remains very high. Hospitalizations are still increasing. And I think a lot of that is that we're still seeing leftover Delta as well as Omicron from the holiday seasons. We've been maintaining our prediction ever since September that we knew that cases were going to rise and hopefully start decreasing in mid-January. So we are about 9 days away from that. And hopefully cases will start decreasing, as well as our hospitalizations and ICU and ventilator days. That's it.
Thank you, Dr. Wu. I'm going to turn it over to Eric Arlia now. The CDC did approve the booster shots, the Pfizer booster shots for children ages 12 to 15. Talk a little bit about that process, and now parents can sign up at hartfordhealthcare.org/vaccines to make appointments. Talk a little bit about the process.
Yeah, so exciting to see another age category get added. It became official at about 9 o'clock last night, and we had been preparing for it. So our IT systems are all set up, and you can in fact make appointments for children ages 12 to 15 to get the Pfizer booster. I took a look this morning, and there are ample Pfizer booster appointments available in our system as of this morning. So I really would encourage everyone to take a look and see if there's a time and a location that works for you. There was also another change this week that I wanted to note because, we just heard Keith, talk about just how impactful getting the booster is. The CDC also shortened the amount of time between the original vaccine series and the booster for people who got the Pfizer brand vaccine from 6 months to 5 months. So if you're out there and you were waiting for that 6-month window, you can now actually, if you're at least 5 months past getting your original series, you can actually schedule your booster now. And as we are looking at this probably being our peak, at least for the foreseeable future, that could become really important for people, having that ability to maybe move up when you were planning to get your booster. So those are 2 really exciting updates. We've talked a lot about the new medications that are available that we've started using, but it always comes back to the vaccine. The vaccine and the booster is our best defense against COVID. So really happy to be able to offer that booster to a larger population.
Eric, thank you for the update. I do want to bring in Dr. Jennifer Ferrand right now. Dr. Kumar had alluded to this in the beginning about colleague support. Colleague wellness is extremely important to all of us. especially Dr. Ferrand and Sharon Kiley, who leads up our Chief Wellness Officer, who we had on yesterday. But we wanted to expand on the conversation a little bit because this is an important topic. Colleague support, we've been in this for 2+ years now, and it's extremely important that this work is so vital. So Dr. Ferrand, take it away in all that we're doing to support our colleagues through this pandemic.
Sure. Thank you so much. I want to start by saying I'm very proud to work for a system that really cares about the well-being of the workforce as much as we do here in Hartford HealthCare. And also state that we were poised to do this work long before the pandemic erupted. And that work has really laid the groundwork for us to be a resilient organization where we can bounce back from crisis and be even stronger than before. And so what we've noticed is that the experiences of the healthcare workforce are evolving as the pandemic wears on, and every phase presents new challenges to healthcare workers. And it's actually really hard to track the numbers in a dynamic landscape, but nationally we're seeing 60 to 75% of clinicians reporting symptoms of exhaustion, depression, sleep disorders, and PTSD, with our nurses being equally, if not even more, distressed. And this represents a significant increase from pre-pandemic levels of healthcare worker burnout and distress, which were already hovering at around 40%. And also at a national level, we see staffing shortages, and we're feeling those pressures here in Hartford HealthCare as well. Coupled with higher volumes of patients to care for, it leads to a level of fatigue for our workforce that can be dangerous. So we think that it's really important to remember that healthcare workers are humans first, and they're not immune to human problems like getting sick ourselves or having to manage lots of complicated issues in our personal lives, all while managing the demands of our very important professional roles. So what we have in Hartford HealthCare is a very engaged workforce who find great meaning in their work. And this is wonderful for our organization to have a workforce that performs at an extremely high level, but there's also a personal toll in the sense that it's hard to turn that off when we're not at work. And that's partly how burnout happens. So in terms of caring for our workforce, our fundamental strategies here in Hartford HealthCare haven't really changed since the onset of the pandemic, although we're trying to be more flexible in the way we do our work so that we can best respond to the dynamic needs of our organization and our colleagues. So our strategies are evidence-based, and they fall into 3 primary categories. The first is that we help people to assess where they're at and how they're feeling. We provide a tool for people to do that easily through a mobile app, because we believe that just like you can't address high blood pressure without knowing that you have it, you also can't address burnout or distress without first being aware of it. So the second thing we do is we help people address their stress or distress by providing resources, education, and support directly and through our partners, including our HR benefits team and our own behavioral health network. We've modified our communication strategy to provide very clear and straightforward information about how and where to get help. And we're revamping our training and education programs to introduce and reinforce what we think are the core competencies leading to resilience and professional fulfillment, recognizing that people don't have a lot of time to access this material. So the third thing we're doing is destigmatizing all of this and encouraging people to accept help. And we're doing this by supporting our leaders to monitor their own well-being, to model good health behaviors for our colleagues, and to also recognize when somebody needs assistance and feel skillful at being able to direct our colleagues to resources that exist internally and externally. We also think it's really important to honor and recognize the sacrifices and the commitment that our healthcare workforce has made these past 22 months. And so we practice showing gratitude and saying thank you in as many meaningful ways as we can. And I noted earlier that healthcare workers are humans first. And so it's important to acknowledge that these are very human problems that we're facing right now. And one thing the pandemic has taught me as a behavioral health professional is that sometimes we don't have a tremendous degree of control over our circumstances. So we have to accept and push through some really uncomfortable realities, but we're doing it together with caring and compassion for ourselves and our patients and our colleagues. And so all the things that we're doing strategically here in Hartford HealthCare support those aims.
Dr. Ferran, thank you for that very robust overview. I do want to take this time now to open it up to reporter questions. Our first question comes from Tracy O'Shaughnessy at the Waterbury Republican American. The American Medical Association has come out against the CDC's new quarantine and isolation recommendation, citing a lack of testing that could cause further spread of the virus. Do you believe the CDC's guidance is correct, or do you believe a longer or shorter isolation period should be required?
So the CDC guideline is based on a number of factors. So one of the primary factors is looking at when individual highest period of infectivity exists, and the appreciation of the use of proper PPE. The CDC guideline clearly states the need to maintain proper PPE to include a face mask even after the period of isolation that they've identified, or the new period of isolation that they've identified. I do understand the stance from a number of institutes that have come out and speak against the CDC guideline. But as it stands right now, currently, Hartford HealthCare has established, we've looked at this as scientifically as possible. And we've decided to stick with our current process, which is more than what the CDC has put forward as a health system. But by no means is it an attestation that we are completely in disagreement with what the CDC is saying. This is what we're capable of doing right now, and understanding the intent of the CDC. But again, it is based on the most infectious period of a person that is positive, and the appreciation of proper use of PPE, even after we've surpassed that high rate or high time frame of high infectivity.
Thank you, Keith. Our next question comes from Jordan Fenster from Hearst Connecticut Media. Can you please discuss the status of those 7 boosted patients? Are they immunocompromised, older, younger?
They're older, so average age is over 60. And as I said before, I really think if we're looking at a true definition of boosted, there's really only 2 that we do have. Just looking at the time frame, we have one person, for example, who is here the day after getting their booster shot. So I don't know if we would count that person, but again, average age for the 7 individuals is over 60.
And remember, the CDC definition for boosted is different from the clinical definition of boosted. The clinical definition of boosted does include a booster within the last 2 to 4 weeks having completed the primary series. The CDC considers fully vaccinated as still having completed the primary series, irregardless of the booster.
We have a series of questions from Dominique Moody at NBC Connecticut. Good morning, Dominique. The first of his questions is, what is it that the public needs to know about what's being considered Flurona, someone testing positive for both influenza and COVID-19? Dr. Wu or Keith?
So this is a new term that we found late last night and started reading more about, yesterday, and started reading more about, which is basically the flu, and I guess the COVID-19 is a co-infection. And it's not a new concept. In fact, very early in the disease process, we didn't see much of these cases, but we did see a few of these cases. And I think the first one was identified not in the US, and they've subsequently isolated a few cases. But again, it is an appreciation that respiratory diseases do coexist. So you do have individuals that are co-infected with more than one respiratory virus at the same time, or respiratory pathogen at the same time. And just as COVID-19 and influenza, the possibility does exist. The complexity or complication for us as it stands, or to be honest, it adds some simplicity. The disease presents very similar where symptomology is concerned. So I don't think this is something groundbreaking. It exists, it's existed for a long period of time, and it's not going to change.
Is there a concern about Flurona? How can the public avoid it? Dr. Wu?
So just going back to that, we also have to be very careful with our diagnostic capabilities. Isolation of the virus from your nasopharyngeal tract does not necessarily mean that you have both diseases. And so there you can have a colonizer or carrier state and not actually having caused infection. So we have to be careful when we diagnose somebody with Flurona, because they may actually just have one or the other, or they could certainly have both. But to answer your question, Tina, masking. I mean, this is tried and true. It's look how much better our influenza cases were last year. We had barely any rhinovirus, parainfluenza, human metapneumovirus, adenovirus, RSV. That was all non-existent last year, and we can attribute that all to masking.
And I think that segues into Dominique's next question. How many flu cases has Hartford HealthCare reported this season? Is it higher or lower than last year? And I think you just answered that. Universal masking cut down on the flu activity.
Yeah, so it's higher than last year, but it's much lower than 2 years before. So I think we've shifted our baseline for flu quite significantly. I know we talked about this before on this forum, wherein we looked at a certain period in time wherein we had 8 flu cases last year, and at that very same period, the year before, we were looking at about over 6,000 cases. It's a quite significant difference, attributing to a number of mitigation strategies, most of which we believe is the masking and to include mask mandate. So again, I believe we're at 170 right now. I can get the exact data for us, but I believe that's where we are currently. So the data or baseline is definitely going to be shifted over the next few months, impacted significantly by our use of PPE at this point in time.
Next question, also from Dominique. Are there any contingencies tomorrow for your clinics given snow is on the way, testing, vaccine, booster appointments? Dr. Kumar, Eric, do you want to take that?
I could take a stab at it. So, I remember, working through these issues last year. It's been a while since we've had to think about it, but all of our vaccine clinics are on our hospital campuses or in one of our medical group practices. So we would follow that hospital or that location's guidance on whether to stay open or closed. I think it's likely we will stay open, but in the event that we did close, as I mentioned earlier, we have ample vaccine appointments on our calendar, and certainly we would work with those individuals impacted to reschedule. And then if someone voluntarily decided not to come because they didn't want to travel in the weather, again, I would say right now, I don't think they would have any difficulty rescheduling their booster as early as the beginning of next week.
Eliza Fawcett from the Hartford Courant. Dr. Kumar said earlier this week he expected Connecticut's COVID-19 peak to come within days, while Keith said he thinks it could be weeks away. What accounts for what the disparity, and what variables make that difficult to predict?
There's only one single source of truth here is Keith Grant, by the way. So
thank you for pitching me against my boss. I appreciate it.
I could be the tiebreaker because I certainly gave my prediction. I mean, January, I'll let everybody else certainly jump in, but I still, we have been maintaining that January, the middle of January is where we really expect numbers to start decreasing. The variables, how well are people, I guess, for lack of a better term, are they social distancing? The parties are over, hopefully. Hopefully people are not cohorting as much indoors. And that's why we've always picked the middle of January. The big thing is Omicron. How deadly is it? How much are people going to be showing up in hospitals? I think on previous talks, we've talked about the tri-phase phasic peak of the three humped camel, of Delta, then Omicron, then influenza extending into February. But I will stop there. I maintain that we are going to still start seeing decreases by the middle of January.
I agree with Ulysses. I do think Omicron adds a very interesting element to the mix for a number of reasons. If you look at where the UK's health systems peak is, where Omicron was appreciated about 75, 85+%. And in the state of Connecticut, I think we're still hovering, we believe, at about 65+%. So I think we have some time to go. So not in a few days. But at the same time, the other thing that we need to, Ulysses and I are having some conversation, and Dr. Kumar have some conversation about, is Omicron adds a different element in that we have, with a disease that is create less symptoms or less critical symptoms, it gives an individual the perspective that I might have COVID, or I have no idea if I have COVID, but it creates very viable vectors, so individuals that have the ability to go out and spread the disease. So we're still looking at that very, very, very closely. So there's a lot of elements. And again, I'm interested to hear what Dr. Kumar has to say.
I think it's really important to parse out the data. When we talk about the hospitalization, we have to remember that as Omicron spread or prevalence becomes much more widespread in the community, we would see individuals coming to the hospital who happens to have COVID, but coming with different reason. So when we present the data on the hospitalization side, how many of people are positive, it could be misleading in the sense that they may not be here for COVID reasons. So essentially, the hospitalization data doesn't really help us in understanding the peakness of this infectivity. What Keith is referring to, or maybe the confusion we might have created for you, is that in the community prevalence, which is still rising at the moment, because we have a fair amount of individuals without boosters in the state of Connecticut. We have a fair amount of individuals who are not vaccinated. So this virus is still able to find some host. And depending on our social practices, we will see the speed of peak, achieving the peak at a different level. And that's where the challenge comes in. I think the most important thing from a healthcare system perspective, the community needs to know, irrespective of what the peak in the hospitalization is or the prevalence peak, we all have to follow the right appropriate precautions, the social distancing, the masking, and other details. And healthcare system is well prepared to take care of the patients and not stressed to the level that we may have to curtail services. And I think that's the most important message folks need to take from that conversation.
Our next question from Tracy. Keith, you said your data revealed that 24 patients of the 413 patients you were treating were vaccinated, and that 3% of those were in critical care. Is that correct? And can you tell us if there are any special moralities or health concerns among that 3%?
I don't have the specifics for breakdown for comorbidities. I think that's what you're asking for, but yes, so vaccinated, it was 158 that's vaccinated, but when we look at the true definition of fully vaccinated, then, we break it down to a time frame, and we hadn't included the new inclusion of 5 months versus 6 months for Pfizer. But I'm sure if we look at that as well, we'd have even some reduced numbers. But just based on that, we had 22 patients that fell into that category. And then looking at our booster category, if we add that to it, and if we further redefine or appreciate the true sense of what booster mean, as outlined by Ulysses, for that 14 days, we have only 2 patients that are truly boosted. So adding those two numbers, we have 24 patients that are truly considered optimized or optimally protected from the vaccine that's included in that 413. If you talk about a 3%, as I stated before, we do have, but I don't have the exact comorbidity that each of those patients have that are in critical care. I can look up that and send it out to this team.
Thanks, Keith. Two questions from Dominique. Can you get your flu shot the same day you get a COVID-19 vaccine or booster? And then the second part, how important is your flu shots? Maybe Eric, do you want to take the first part, and Keith and Dr. Wu the second part?
Yeah, so there's kind of two answers to that. There's the clinical answer and the logistical answer. So the clinical answer is yes. There's no reason why you can't get both of them. Many can get both on the same day. Most of our medical group practices have the COVID vaccine and are actively working with patients as they see them for both flu and COVID vaccination. And if they haven't had either, those patients can in fact get both on the same day.
To answer the second question, I'm not going to mince words. I almost feel like this is a trick question because we're never going to say flu shots are not important. So yes, they are very important.
The only thing that I know there's a lot of information out regarding not taking both together, and I think a lot of the information is just based on having just mild side effects from both flu shot and from COVID-19 vaccine as well. So that's primarily where most of the information that I've read that are pointing to, and there's some sense to it. So yes.
Great. I don't see any additional questions in the chat. So we will get those numbers to you as requested. But for final thoughts, let's begin with Dr. Ferrand first.
Can I just add,
Go ahead.
Jennifer, if you could elaborate a bit on our community about the well-being measures one can take from your expert eyes. I think that would be helpful for people to understand in these times of stress, how one can manage as well.
So if we're talking about our healthcare workforce specifically, there's two primary ways I think people can assess their well-being. One is through a mobile app that we've launched in the organization here since October. It's a 9-question measure that identifies level of distress in 6 dimensions, including meaning in work, likelihood of burnout, severe fatigue, work-life integration, and quality of life, and risk for severe psychiatric illness. And we are really promoting this tool in our organization. It takes about a minute to complete. And what's really nice is for the end user, it connects you immediately to resources and information that can help. And also it's a tool that helps people track and measure their own well-being over time, but it also provides us with information as an organization about how people are doing, right? So like we get feedback around how many people are using this tool and what are the sort of the high level findings from the tool. It is a totally private and confidential tool, so there are some limitations in terms of the information that we get, but our goal is to help people become more aware themselves of how they fare in relation to their colleagues and to a national norm sample, so that people have the knowledge and the skill to act on their own behalf.
Jennifer,
The other way,
how about community? If I'm not a healthcare provider, I live in Connecticut, what do I think about my well-being? How do I manage that?
well, that's a big question. So I'll answer that as a mental health professional.
Exactly.
I think we have wonderful mental health resources for our community members. The easiest way to access them is to call 211, which is both a crisis line and a warm line, right? So that you can be connected to somebody 24/7 who will actually respond to your call and can help you make that distinction around like whether this is something normal that I'm experiencing, or is this a problem that rises to the level of clinical significance, and should I seek help, and where can I get that help? It's also a way to seek help around things like, where do I go to get childcare? Where can I go to find a group for Alcoholics Anonymous or something like this? So it's really sort of a wealth of information about what all information is available and support that is available to people in our state that will support your behavioral health and your mental health. That's probably the easiest way to answer that question. That's a big one.
Thank you, Dr. Ferrand. We appreciate that. Anybody else have any final thoughts that they would like to say at this time? Eric?
No, really just to reiterate, it's been exciting the last couple of weeks having some new drug therapy options to help treat people who do come down with COVID. But I'm just always struck when I see the data from Keith and Dr. Wu at just how effective the vaccine itself is at keeping us all safe. Can't stress it enough. It is our #1 weapon and helping prevent serious illness, which is really what we're trying to do. So just want to continue to encourage everyone, get the vaccine, get the booster, take a look at the new time frames, see if you're eligible to get it sooner than you thought.
The efficacy is definitely in the numbers. We see that. Dr. Kumar, any final thoughts before we wrap up?
I didn't address the capacity issue, and unsurprisingly, nobody asked the question. Hartford HealthCare continues to have all services and ready to be delivered for the community at this time, and we are managing this volume, especially in the emergency rooms, and requirement for testing reasonably well at the moment. I do want to acknowledge that our colleagues across the system are working hard. They are working extra shifts. They are putting extra hours every single day, every single minute to make sure we meet the need for the community at this time. And that's the only comment I would have. And I hope those individuals who have not taken the vaccine, please consider taking a vaccine. Those individuals who have not taken the booster, but they qualify for that, please reach out for boosters. They are effective tools to keep us alive.
All right. Thank you to our panel for joining us today, and of course the media as well. We will see you all back here tomorrow at the same time at 11 a.m. But for now, be well. Thank you.
Thank you.